Hi everybody. In this video, we're going to start looking at the bones of the face. So there are 7 surface bones of the face. They include 2 nasal bones. The nasal bones are right there. That's not technically the completeness of the bridge of your nose. Kind of makes up the root and kind of the superior bridge of your nose. The rest is cartilage. So there's 2 of those. There are 2 zygomatic bones. Those would be your cheekbones right there. There are 2 maxilla bones. People don't realize that your upper jaw is actually made up of 2 bones, the maxilla bones, and 1 mandible. And it's right there. That's your mandible. First, we're going to look at the nasal bones. There are 2 of them. Again, they kind of make up it's the bridge of your nose, but technically it's kind of the root and superior portion of the bridge of your nose. The rest is kind of cartilage. It's kind of the dome over the superior portion of the nasal cavity. They lie directly inferior to the glabella of the frontal bone, and they actually dip posteriorly below the glabella. So that's one thing that's kind of important to remember, that when you're putting a nose on a skull, like on your plastic skulls, make sure that you know where the glabella is, because then you can know where the kind of superior border of the nose is, because it always has a little bit of a dip. Even if there's an arch in the bridge, there's still a dip below the glabella, and it keeps your nose kind of the right length, if you remember that. The nasal bones help to make the nasal cavity. So there's the nasal cavity. Again, it is bound by the nasal bones superiorly, so up here, and by the maxilla. So the maxilla bones also make up part of the nasal cavity. Now that nasal cavity has 2 sections, 2 areas, if you will, that is separated by cartilage, and those areas are not usually symmetrical. They're usually irregular shaped because the septum doesn't quite fit right. So the septum is the cartilaginous division. The septum is not bone, so it is actually here. It would be here if this wasn't just a skeleton. It is cartilage, and so that decomposes, but it is held in position by the vomer and the ethmoid bone, the perpendicular plate of the ethmoid bone, to be precise. These bones don't line up perfectly, this vomer here and that perpendicular plate of the ethmoid bone. They're a little bit off, and so that's why people's noses don't tend to go straight up and down. They tend to be off to the side a little bit, or have a little bend in them, if you will. This does tend to cause, again, that shift. If it's really bad, you can get what's called a deviated septum, and you don't breathe very well. Also found in the nasal cavity are the inferior nasal conchae, which is not easy to say. The inferior nasal conchae are these little scroll-shaped bones that you find in the inferior portion of the nasal cavity. And they do actually have a use in restorative art. If you have a nose that has had the mass of the nose shifted over, you can use a U-shaped pin to insert into those little areas of the inferior nasal conchae, and you can use that to shift the nose back over and then push that U-shaped pin into the tissue, and that will hold the nose in place. This is not due to tissue being bent. So a lot of times when people are on like ventilators, they'll tape the ventilator to your nose and it bends the tissue of the nose, but didn't do anything to the bone or cartilage. You use the inferior nasal conchae if the septum itself has kind of shifted over. I've done this once and it actually does work. The last structure in the nasal cavity that we're going to look at is the cribriform plate. We mentioned this in the bones of the skull, that the cribriform plate is part of the ethmoid bone. The ethmoid bone is an interior skull bone. Here's the cribriform plate up here. It forms a little bit of the base of your skull, and the cribriform plate is used to puncture. In cases where we have possibly protruding eyes, usually due to some kind of gas buildup. Small caliber gun wounds do this quite a bit. Gas gets into the skull and it has nowhere to go, so it kind of protrudes the eyes out. To get the gas out, you would puncture the cribriform plate with a trocar. Or in cases where you have brain purge. Car accidents are pretty common to have brain purge. Brain purge comes out of the ears most likely. Can come out of the nose, mouth, and or eyes, but it's usually the ears. It's creamy whites, usually has blood mixed in with it. But again, that purge is coming out due to some kind of pressure, which could be liquid, could be gas. We puncture the cribriform plate, and that way we can get that gas and liquid out, and we can also introduce cavity fluid into the brain. So you'll see this in embalming lab. We'll actually puncture the cribriform plate after we take the brain out, so you'll be able to see what it looks like from the inside of the skull. So moving on from the nasal cavity, we have the zygomatic bones. There are two of them. Those are your cheekbones. So your zygomatic bones here are located on the frontal and lateral planes of your face. They form part of the inferior and lateral surfaces of the orbital cavity here. And we do use the zygomatic bones to find the width of the frontal plane of the face. You'd actually measure from the center of each zygomatic bone here. That gives you the width of the frontal plane of the face. Now, remember that we measure the width of the face with using the zygomatic arches, which are part of the temporal bone. The temporal process of the zygomatic bone there. We call it the temporal process because it is the part of the zygomatic bone that articulates with the temporal bone. Okay, so it's what connects the zygomatic bone to the zygomatic arch. So that's where technically the zygomatic process of the zygomatic arch articulates with the temporal process of the zygomatic bone. The zygomatic tubercle is at approximately, it's down on the bottom part. It's the inferior kind of triangle of the zygomatic bone. That zygomatic tubercle, we use it to find technically you can use it to find the proper placement of a nose because it is approximately at the same level as the base of the nasal cavity. So if you find the bottom of the zygomatic bone, the zygomatic tubercle, that lines up pretty closely to the bottom of the nose. Next are the maxilla bones. The maxilla bones form the upper jaw, and there are two of them. These are the bones that cause problems if people have cleft lip or cleft palate. Those bones didn't articulate, they didn't form properly, and so that's why you end up with that gap. They kind of form the skeletal base of the most superior portion of the face. Here, that part is the maxilla. They do form the anterior roof of the mouth, which you'll see the hard palate. The sides and floor of the nasal cavity interiorly, and part of the ocular cavity. An important part of the maxilla is the nasal spine. That's that little protrudy part. You can feel it if you press your finger up the bottom of your nose. That's technically you're pressing on the nasal spine. And that's at the inferior portion of the nasal cavity. It's where the maxilla articulate with each other. And that forms the bony anatomical limit of the nasal cavity. So your nose does not go past that nasal spine. If you remember in lab, they always talk about don't cover that nasal spine because that shows you where the bottom portion of the nose should be. The frontal process of the maxilla is the kind of superior portion of the maxilla where it goes up and articulates with the frontal bone. That frontal process will form the lateral margin of the nasal cavity, so here and here, and it also forms the medial margin of the orbital cavity, so here and here. The zygomatic process is where the maxilla will articulate with the zygomatic bones here. Okay. And so this zygomatic process provides the direction for the anterior concavity of the cheek. As your zygomatic bone kind of rounds down from your eye socket, it dips in a little bit, and that's due to this zygomatic process being kind of concave. Those are kind of the surface aspects of the maxilla. Now we're going to look at some of the interior aspects of the maxilla. So one is the palatine process. The palatine process forms the anterior hard palate of your mouth. So if you put your tongue right behind your teeth, that's the palatine process. It helps to form part of the nasal cavity interiorly and part of the ocular cavity interiorly also. That palatine process has a horseshoe shape. You can see that horseshoe shape is important because we'll talk about when setting features, maintaining and or recreating the anterior convexity of the mouth. Now, connected to this palatine process are the alveolar processes. The alveolar processes are little tiny bony ridges. They describe them as being spongy bone that surround the alveoli of your teeth. So it's what kind of holds your teeth in a little bit. The alveolar processes, if you lose your teeth, get reabsorbed into your jaw, and that's why elderly skulls that don't have teeth look a lot smaller than maybe they should, because they've drawn in some of that bone. It's also important to remember that they do that because when you're setting features and retrieving the mandible, closing the mouth, some people will use needle injectors. Well, needle injectors rely on solid bone. People that don't have teeth don't have solid bones in their mouth because of the tooth loss and the loss of these alveolar processes. Now, the alveolar processes are kind of held in something called the alveolar arch. It's basically the palatine process, the kind of outer border of it, if you will. And the alveolar arch, again, is this horseshoe shape, and it actually gets wider as you go back. So the anterior portion of it is a little more narrow than the posterior portion. The alveolar process contains 16 teeth. So you have 16 teeth in the maxilla. You also have alveolar processes in your mandible. You'll have 16 teeth there, and so you have 32 teeth normally. You have 4 incisors. Those are the front teeth, the anterior teeth. You have the canines. Those are 2. There's 2 of those. The alveolar arch, if you notice, kind of changes directions at the canines. So it's got some anterior curvature here, but it takes on that really horseshoe shaped right after the canine. It goes kind of more directly back. You'll then have 4 premolars or bicuspids and 6 molars. Those are the back teeth. All right, so that finishes it up for this video on the bones of the face. Next time, in the next video, we're going to go through the mandible, so the lower jaw, and prognathism.